Viva is a complete marketing system that addresses factors essential to the expansion of the dental practice. Like any other marketing program, Viva starts with helping you get new patients into your practice. Advertising does work. The problem with advertising is that the cost of customer acquisition is too high. The average is about $300. Common marketing programs available to dentists are direct mail, television, radio, and internet. Television and radio are usually too expensive because they cover a much larger area than an office could draw patients from. Internet-type advertising, such as Groupon, works pretty well to get patients in. Problem is, they usually have their own dentist and are just coming in for the offer. That's why most doctors who have done Groupon in the past don't do it again. This leaves us with direct mail. Direct mail works, but at a cost of around 39 cents to print and mail an oversized postcard, it will usually end up costing the doctor around $300 to get a new patient. $300 per patient may be acceptable to the doctor, but the real question becomes how many of those patients actually will end up becoming patients of the practice. Our experience with direct mail is that only about 10 to 15% will become a patient. Almost everybody agrees that the best patients come through referrals. A referred patient is much more likely to accept treatment than someone responding to a flyer or a postcard. Regardless of how you advertise, any advertising piece today needs to have an introductory offer to entice the recipient to come in. This is very important and is very often a problem. The better the introductory offer, the more responses you get to your advertising. For example, if you said, "Free iPad for all new patients," you're going to get a lot of people coming in for the iPad, but very few will end up accepting treatment. They only came in for the iPad. On the other hand, you could say, "Dr. Hughes now accepting new patients. Call us if you have any dental problems." You could get a few responses and treatment plan acceptance would be high, but only if someone has a dental problem and wanted to see Dr. Hughes. So there is a balance between the desirability of the offer and the percentage of patients coming in that end up becoming loyal patients. The Viva program addresses 4 factors: new patient acquisition at an affordable cost, treatment plan acceptance, patient retention, and patient reactivation. New patient acquisition is done primarily through a referral system within the office. The referral cards are handed out to your existing patients, which they pass along to their family and friends. This part of the program is as simple as that. To jumpstart your referral program, Viva mailers can be sent to your patients with your introductory offer card to share with a family member or friend. This obviously gives you a faster response to your program, since you're distributing a larger volume of cards at once that your patients can pass along to friends and family. And as long as you're sending a card to share, why not include a card for the existing patient to use for treatment, since there are always a good percentage of patients who have treatment plans that are either not started or have been left incomplete. Patient retention and reactivation are also accomplished by continuing to communicate with existing patients as well as patients who have not been back to your office. The more your patients hear from you, the less likely they are to respond to another dentist promotion. The Viva program has an external aspect to marketing as well. Viva packs can be passed out to local businesses as gifts to invite employees of the business to come in. They can be given extra Viva packs to pass out to their best customers. In effect, they can become an outlet to distribute your cards. For businesses you particularly want to target, Give them the Signature Edition Viva Collections gift box. This elegant gift contains 16 Viva packs in 8 dynamic designs, along with your introductory offer card on one side and a gold foil-wrapped Belgian chocolate coin on the other. To expand your external marketing, Viva mailers can be sent to homes and apartments by zip code and carrier route. While response to direct mail is typically low, we have found that our aesthetic mailers have a much higher open ratio and better response rate than traditional direct mail. Our intention has always been to keep the cost of getting a new patient low. To do this, we have invested millions to buy the equipment necessary to produce all of our products internally. The program would be too expensive if this were not the case. The final element of the Viva system is your online dashboard, used to track the response of your program and success of your Viva system. Here's what we know. Take away the design of the cards that we do for your office, the training, the technology, magnetic tracking, and online dashboard. We know that what we charge for the entire program is less than a quarter of what it would cost someone else to just print the products alone. Viva offers programs tailored to the growth of your practice. A Viva representative will be able to assist you with the best program for you. How many new patients do you need? Call Viva today.